Well, we've learned first and foremost that we need a team to get anything done. And when I say we need a team to get anything done, that means we need a workforce within the Patient Safety Collaborative itself. But beyond that, we need a team of people out there in the system that can help and support the work that we do in the Patient Safety Collaborative. I think the biggest thing we've learned is we've got to get out and engage with people, tell them the story, ask them their opinion, make sure that the problems we think we're helping solve are actually problems that they think they have.
The Deteriorating Patient Workstream is one of 3 workstreams that the Patient Safety Collaborative are required to deliver on. And of course at this moment in time we've got a national drive from NHS England and NHSI to help facilitate implementation of the National Early Warning Score version 2 across our acute systems, and that's acute trusts and the ambulance service. We held our first learning system launch event in May this year, and what's become obviously apparent to us is that there's a great interest across the system, not just within the acute sector but out into the community and within primary and community care.
Highlights of the last 4 months for me have been the recruitment of an absolutely fantastic team of people. And then you can add in some events that we've run, I think, that have really raised awareness about the Patient Safety Collaborative itself. The first one being a maternity and neonatal event, and the second, the deteriorating patient event. Both were absolutely phenomenal in conveying our messages to the system, but I think most importantly the way that we developed those meetings I think is getting better and better. I think the future absolutely has to be more about us listening and co-creating and co-producing solutions to problems that we actually identify within our own system.
It certainly helped us to focus on what we have achieved in a short period of time. It also helped us to identify our sort of direction for the future.
What we learned as a team, not only about the work that we've done, the progress that we've made and the journey that we're on, I think we also learned even more about ourselves and our resilience and our strengths as people within that team. And I think it gave us pause for thought about our direction of travel. I think we'll trim our sails and alter our rudder in certain aspects. I think we'll feel more proud about some of the things that we are doing and less uncertain about what we have done, what we can do and what we're about to do. I think we all agreed at the end of the day that it was hugely, hugely beneficial, and can't wait to hear back from the team that came to review us, what they learned from other teams that we can potentially adopt into our own thinking and maybe spread across our own patch.